With the legalization of medical cannabis over the past 20 years, really, there's been a lot of policy updates and a lot of questions and issues for practitioners and clinicians. And today we're going to talk to Clifton Uckerman about all of those. Welcome back to Discover Marijuana. I'm Tim Pickett, and I'm here with Clifton Uckerman, a licensed clinical social worker. Today we're talking to practitioners. We're talking about policy changes and what's happened with medical cannabis coming up. One of the questions that we want to kind of start to address is this history of PTSD and how PTSD became such really the prominent diagnostic issue that we can treat with medical cannabis. I remember that, going through my education on medical cannabis, which we don't ever get as clinicians except for self-taught. PTSD sticks out as really the focus of, or one of the two major focuses of being able to get medical cannabis legalized. And it came really from the Vietnam era where, essentially the hippies and the veterans were coming back and they were smoking a lot of weed that was treating their post-traumatic stress disorder. That's how it became something that we were able to argue for. Because these veterans, they deserve to use whatever medication they need to. And they were already using it because the current therapies weren't working. So I think that's how we got here, and we got PTSD as the main mental health condition. But it's certainly not all that PTSD encompasses just for the veterans.
Right. So you're telling me that in the state of Utah, with the legalization of medicinal use of cannabis for qualifying conditions in the last couple years, PTSD is the only mental health qualifying condition on that list?
Yeah, the only mental health condition allowed in Utah law for a medical cannabis card is PTSD. And even though we know that 85% of cannabis users are using it for some other mental health condition, we're only allowing PTSD as the diagnostic criteria. Plus, not only do they have to have a diagnosis of PTSD, but they also have to be in current treatment. That is also the only condition in Utah where you have both. You have to be diagnosed by somebody who's a licensed clinical social worker, psychiatrist, somebody who works in mental health, and you have to be in treatment. No other conditions require the treatment.
So I'm wondering why PTSD in Utah as the only qualifying condition. So you're saying that it really came from kind of the era of veterans returning from
That's how it started.
Combat, Vietnam, hippies back in those days, 60s and 70s, with symptoms, mental health issues. And this was a form of medicine that maybe has, over time, had more of a kind of a noticeable positive impact in people's lives, and something that we've maybe had some more research around.
Yeah, there's been good studies, and in, I believe it was 2017, the government funded a review of all the medical cannabis literature, and the National Academies of Science came out with reasonable evidence that PTSD sufferers can be helped by using medical cannabis. But that expands it from the veterans only into the general population, because we know it's not only veterans have PTSD, right? As we've talked about before, it's a lot of people. But the scare with cannabis is that there is a risk of psychosis with high levels of THC use. And so anxiety and depression didn't get on the list, because sometimes when people use high doses of THC, they get worse anxiety. In this conservative state, right, PTSD was the only one they wanted to allow.
And so is that because with PTSD, so we're thinking flashbacks, nightmares, a really inflamed central kind of nervous system,
fight or flight
response, emotionally reactive, maybe some social withdrawal, some dissociation. And so we're thinking, based on literature and research, the little bit that we have out there, and the anecdotal evidence, people that are saying this really helps me with this, even though there's no research on it.
Yeah.
We're saying because of all those symptoms with PTSD is the only qualifying condition, and we're seeing that medical cannabis can have a really kind of quick,
very quick,
low cost.
Yep. For some people, really low cost, if depending on how they access it.
And maybe some lasting positive impact if the person uses it as a medicine.
Absolutely. There's two key things when it comes to the physiology of PTSD that I was taught and how cannabis will help. So we know that THC will suppress dreams. So people with flashbacks and nightmares and night terrors, CBD and THC can be used to suppress the dreams. So a nice symptom treatment for somebody with PTSD. And then we also know it helps soften the connection between the emotional part of the brain where that trauma might be housed and the logical part of the brain, which are reacting inappropriately with PTSD. And cannabis will help soften those connections so that the behavioral health therapy can work to, what do you call it? Reassociate the memories or work on those memories so that they're not as affected. That's really your wheelhouse.
Yeah, so this is probably where we start talking about, further beyond where we've come from, where we're at now, and kind of how we're using medicinal cannabis for the use of PTSD treatment. So as a behavioral health professional, licensed clinical social worker, my training is to assess, diagnose PTSD, and then come in and complete a treatment plan with the patient. And in that treatment plan, think about what we're going to be talking about from one session to the next. Now with medical cannabis, we also have to be thinking about, how are you going to be using medical cannabis in conjunction with therapy and all that we're talking about. So a lot of times if we're doing trauma-focused work, treating a PTSD diagnosis, then we have to kind of reopen the wound a little bit. We have to go back to the memory and allow the patient, once they've created that safety for themselves in the therapeutic relationship, really begin to kind of talk about the things that have been very painful to talk about and that they've probably avoided talking about for a long time. So with a lot of my patients, when they use cannabis in conjunction with PTSD treatment, it decompresses the central nervous system. It helps reduce the inflammation, because a lot of times they're short-circuited in their brain, like you're talking about, those callous neural pathways, and then their central nervous system is hijacked. So if they can use something, a medicine, that gives immediate relief and has a half-life of, so they can sit on that relief for a couple of hours, maybe up to 4 to 6 hours. And then they can come into session if they've dosed in the morning and be very functional, be alert and calm and aware and have focus and concentration. The patients that I'm seeing don't use cannabis to get high. In fact, they don't want to get high, but they need the relief. So they use the medical cannabis, it decompresses the central nervous system, reduces the inflammation inside of the brain that's causing all that reactive emotional flare-up and that distress, that post-traumatic stress disorder.
Yes.
And then they're able to really just come in and talk about stuff with a little bit more ease, without being in such a fight or flight response, that they can actually sit in the chair or on the couch for a full hour and work through things and manage talking about the painful stuff that they haven't really wanted to talk about, that they've been avoiding.
So to add to this, I think this is why it's so important that practitioners like yourself and we are working together, because we're not only helping the patient learn how to use cannabis, but we're also trying to treat some specific things on our end, and then utilizing cannabis as a way to focus on the present when they're in the therapy and not be distracted by other things. And we know that cannabis and THC will affect the ability of the person's short-term memory and almost focuses people on the present.
Yes.
So they can access these longer-term traumatic memories, but they can be in the room with the therapist. And so set and setting is just so important.
Right.
I think when you talk about what happens next with cannabis, that is, we really just need more research when it comes to these types of therapeutic interventions and this type of therapy. And we can move the needle a little further to the legislation. They're just not they don't have a very big appetite for expanding the mental health issues that they allow cannabis for in most states.
So do you imagine that PTSD, as the only mental health qualifying condition for the state of Utah Medical Cannabis program right now, will be that way for a while?
It'll be that way I think for the next 4 or 5 years, until we can prove really beyond a shadow of a doubt that it doesn't cause more anxiety. But I think that requires you, and it requires good therapy and good follow-up for the patient. There's a lot of anxiety and depression that we know is caused by trauma. We talk about this a lot in our work together. And so I think PTSD will stay the way it is. I just think we'll find that there are more people with trauma that we can treat under PTSD.
Yes. I mean, that's a question a lot of people are asking. They're raising their hands and saying, well, I might not have PTSD or PTSD that I know of or have been diagnosed with or treated for, but I do have generalized anxiety disorder, or I have major depressive disorder, or I have bipolar disorder.
Right. Why do you have the anxiety disorder? Why do you have the depression? Why do you have these things? A lot of that comes from a traumatic event in the past, right? These are things I've learned from you. And so having a full evaluation from a professional like yourself can usually get to the root of why these things are happening to a patient. And then together we can find a way for somebody to access medical cannabis. We can do it in the right way. We can help the patient, and then we can use that research to move the legislation forward in the future. Because I don't think there's a huge appetite for it now. I think that's our job to work with the patients to move the needle further.
Because there's groups of people out there raising their hand and saying, well, what about me? I have anxiety, I have depression, I have bipolar, I have anything else, but I don't have a PTSD diagnosis. So I think what I hear you saying is, well, probably because you've never been assessed for PTSD.
Right, you've been assessed by me. I'm not a professional in diagnosing PTSD. They need to be assessed by somebody like yourself. You know, I mean, you can't say 100% of the time, but often people actually have PTSD. And then we can start treating them with medical cannabis in an accurate way. So we're not having to deal with anything outside of what's truly meant for in the law.
Because I do, when I think about the behavioral health, the traditional behavioral health industry, it seems like a lot of people with diagnoses that are not PTSD, in all the places that I've worked and been in, I don't think we ever really had the instruments or used the tools that was specific to really looking for and finding the trauma or the traumatic life event that is resulting in a post-traumatic stress disorder. And so it would seem like anybody that maybe does have anxious symptoms or depressive symptoms, they could benefit from having a PTSD-driven or a PTSD-specific assessment. And I think that's what we do, is use the tools and the instruments that have been designed to really look for the PTSD and find it.
So if you or somebody you know is interested in medical cannabis but doesn't fit the normal structure of the 15 qualifying conditions in Utah, then I encourage you to reach out to somebody like Clifton Uckerman or somebody who is good at behavioral health therapy and assessments to get a full evaluation on the root of what you're dealing with and see if you qualify under a PTSD diagnosis and truly deserve to have access to cannabis.